As with all household medications, special care needs to be taken to ensure proper storage and disposal of unused medications in the home. Specifically concerning prescription opioids, many hazards are associated with improper storage and disposal. Accidental overdose among children, as well as pets, is the primary concern when it comes to prescription opioids. Diversion of prescription opioids is another factor that has contributed to not only an increase in opioid use disorder, but an increase in hospitalizations and death due to overdose. Diversion refers to family or friends who are not prescribed the opioid, but come into possession of these medications and either use them themselves or share and/or sell to others. These individuals, many times, steal or manipulate in order to gain access to these medications. Rates of opioid-based prescriptions being administered to people 65 and older is higher than any other age group due to some of the illnesses and ailments that come along with aging. This puts aging adults at a greater risk for not only elder abuse by family members and friends who may be seeking opioid-based medications, but also financial exploitation. According to a report issued by Grantmakers in Aging, nationwide, the opioid crisis may have contributed to a rise in elder abuse in rural areas. Lastly, in multiple prescription opioid focus group sessions around Montana, law enforcement personnel have repeatedly reported that removing unused prescription opioid medications from homes can go a long way in preventing misuse at the community level. The following Montana State University faculty and staff helped create the content and graphics of this toolkit. Michelle Grokey and Allison Brennan served as principal investigators. Michelle is the Extension Health and Wellness Specialist, and Allison is the Extension Mental Health Specialist. This team is led by Program Director and MSU Extension Associate Specialist Barbara Allen. Other MSU Extension employees responsible for the content you are about to see include Jennifer Munter, Program Manager, Barbara Watson, Program Coordinator, and Lori Meyer, Extension Family and Consumer Sciences Administrative Assistant. At the conclusion of Module 2, participants will recognize why keeping prescription opioids in the home is an important safety topic for everyone, including the aging adult population. Better understand medication diversion and why it is important to properly store and dispose of unused prescription opioids. Learn ways to safely store medications in the home, and learn the different medication disposal methods that are available. The U.S. as a whole is aging, and Montana is no different. In 2020, 11% of Montana counties had a 65 and over population that comprised 30 to 39.9% of the county population. In 2025, that number will double to 23% of Montana counties having a 65 and older population that comprises 30 to 39.9% of the county population. 5 years after that, in 2030, 38% of Montana counties will have a 65 and older population that comprises 30 to 39.9% of the county population. Additionally, in 2030, a new statistic emerges. 2 Montana counties will have a 65 and older population that will comprise 40 to 49.9% of the county population. Understandably, aging adults experience more chronic pain due to illnesses and ailments that coincide with aging. While it is understandable that older adults require more pain management medications, the higher doses being prescribed to these individuals poses a number of serious risks and hazards. Elderly adults are less likely to recognize the signs of an overdose, such as reduced respiratory rate, dizziness, etc., and thus are less likely to seek medical attention. As our bodies get older, our metabolism changes as well. Aging adults are less able to metabolize medication properly, and when utilizing multiple medications, drug interactions are more likely to occur. With the higher prescribing rates among those ages 45 and over, this means that a greater number of Montana residents will be in possession of prescription opioids and need to be educated about how to keep themselves and others safe when these medications are being utilized. In Montana, many individuals in this age group are farmers and ranchers. Many times these individuals are operating heavy equipment and machinery. This scenario can pose unforeseen risks to this population, as opioid-based medications can cause sedation, dizziness, and difficulty breathing. Today in Montana, there are over 13,000 children living with their grandparents. There are numerous reasons for the increase in this phenomenon, such as parental substance abuse in the middle generation, leading to child neglect and/or abuse, resulting in children being placed in the home of their grandparents. Rates of incarceration are also extremely high among individuals with opioid use disorder. In 2019, 70,630 drug overdose deaths occurred in the United States. Opioids were involved in 49,860 of these overdose deaths in 2019, representing 70.6% of all drug overdose deaths. In Montana, more than 700 Montanans have died from prescription opioid overdoses, with 299 of these deaths being people ages 45 and older. When not stored properly, prescription drug diversion can occur. Prescription drug diversion is the deflection of prescription drugs from medical sources into the illegal market. This includes transferring drugs to people they were not prescribed for. It's against the law to divert drugs. You can go to jail for it. Let's say you had surgery and were prescribed Vicodin for the pain. You don't need it anymore, but you keep it in your medicine cabinet. The next week you have friends over for dinner, and one of them goes into the bathroom, sees the medication is unlocked, and takes a couple of pills. Although you had no intention of harming anyone, and might not even have known this happened, drug diversion took place and you could get in trouble. To give you an idea of how often this takes place, the 2019 Montana Office of Public Instruction Youth Risk Behavior Survey reported over 1 in 10 high school students had taken a prescription drug without a doctor's prescription. According to the National Institute on Drug Abuse, Montana providers wrote 54 opioid prescriptions for every 100 residents. With a large number of prescription opioids in circulation, proper storage of these medications in the home is critically important. Note, if these medications are no longer needed, proper disposal needs to happen sooner rather than later. More information about disposal is covered in the upcoming slides. Keep in mind proper storage involves not only locking up these medications, but also hiding them and keeping them out of sight. First, determine if medications are safely stored and in areas that are out of sight and inaccessible to children. This is not only important for households that have children, but for any home where a child might visit. Additionally, for elderly adults, hiding and locking up prescription opioids reduces the chances that they will be a victim of elder abuse and manipulation. Now I would like to share an example given by a woman in rural Montana and a participant in a focus group held by the MSU Extension Opioid Awareness and Education Grant Team in 2019. She shared that there was a person pretending to go to garage sales, asking to use the bathroom, and then looking for prescription drugs to steal. You might not think this sort of thing will happen to you, but it can, and in the least likely places, a garage sale. If children see an object of desire, they will find a way to get to it. For this reason, storing out of sight, not just out of reach, is critical. Additionally, this will also prevent others outside of children and adolescents from knowing that these medications are present in the home, thus preventing diversion and misuse. Thankfully, there are safe and secure methods for proper medication disposal. Use this listing as a means to prioritize and navigate among the choices that are available and/or feasible for you. We will discuss each of these options in more depth in the coming slides. Since the inception of the National Prescription Drug Take-Back Initiative in 2010, the DEA, along with its law enforcement partners, have now collected nearly 6,350 tons of expired, unused, and unwanted prescription medications. Individuals can drive up and drop off their prescriptions without getting out of their cars. During the October 2019 event, Montana's turned in 1,720 pounds of prescription drugs at 26 collection sites. Disposing of unused prescription medications in a secure drop box is a preferred method of disposal. Fortunately, more and more drop boxes are being utilized throughout Montana. Be sure to visit the link provided on the slide to locate a drop box near you. Here is a list of the items that can be disposed of in community medication drop boxes: prescription medications, pet medications, over-the-counter medications, prescription ointments, prescription patches, and vitamins. Here is a list of items that cannot be disposed of in community medication drop boxes: needles and syringes. For safe needle and syringe disposal, go to safeneedledisposal.org. Thermometers, hydrogen peroxide, inhalers, lotions and liquids, aerosol cans. Medication deactivation disposal pouches are being used more frequently every day. These make it easy to dispose of expired and/or unused medications. By deactivating prescription medications, accidental exposure and diversion of these medications is prevented. If attending a local take-back event or getting to a secure medication drop box is not feasible, disposal of unused prescription medications can happen at home if Deterra pouches are not readily available. The idea is to make the medications that you want to dispose of as undesirable as possible. To do this, follow the steps on this slide. Mix medications, do not crush tablets or capsules, with an unpalatable substance such as dirt, kitty litter, or used coffee grounds. Place the mixture in a container such as a sealed plastic bag. Throw the container in your household trash. Scratch out all personal information on the prescription label of your empty pill bottle or empty medicine packaging to make it unreadable, then dispose of the container. Flushing prescription medications should be considered the last option. Flushing medications can enter water streams. In recent years, a number of pharmaceutical-related chemicals have been found in waterways across the country and even in our drinking water. In Montana, many communities rely on septic systems, which means flushing prescription medications is never recommended. Special considerations need to be taken if a household utilizes a septic system. The following slides will cover this topic in more detail. Ideally, all medications should be disposed of via the periodic medication take-back events that occur on an annual or biannual basis, or the medication drop boxes commonly found in pharmacies, law enforcement offices, medical clinics, etc. However, many times, especially in rural Montana, these options are not readily available. In these instances, disposing of medications in the household garbage, either by using the medication neutralization pouches or a sealable bag with used coffee grounds or kitty litter, is the preferred method. If a household is on a septic system, it is recommended that all prescription medications are disposed of via the household garbage. Flushing fentanyl patches is not recommended, nor are many potent cancer-related medications. Many times, these types of medications alter the bacteria in the septic system, having a negative effect on the functionality of the septic system. Over-the-counter medications are okay to flush when utilizing a septic system. Even when prescription medications are expired, they should not be disposed of by flushing when utilizing a septic system. Again, as mentioned on the previous slide, over-the-counter medications are okay to flush on septic systems, but prescription medications such as antibiotics, antidepressants, cancer-related drugs, or painkillers are not to be flushed down the toilet when on a septic system. Prescription medications have the potential to clog the system and/or harm the biological organisms that exist in the septic system and are essential for proper functioning. These biological organisms, predominantly large colonies of bacteria and enzymes, keep the septic tank from backing up or overfilling. For those who utilize a municipal wastewater system, the FDA provides a list of medications that are recommended for flushing. Please review this slide carefully. Remember, septic systems are different. Prescription medications should never be flushed down a septic system. However, over-the-counter medications are okay to flush if utilizing a septic system. Fentanyl patches, commonly used for pain management, can pose difficulties when it comes to disposing of this opioid-based medication. The U.S. Food and Drug Administration recommends folding the patch in half, sticky sides together, and flushing it down the toilet. Don't dispose of fentanyl patches in household trash where kids and pets can find it. Also, think about the sanitation workers and others who may be subject to possible exposure if thrown away without taking necessary precautions. It's important to note that although the FDA recognizes there are environmental concerns about flushing medications down the toilet, it believes the risk associated with accidental exposure outweighs any potential risk associated with the disposal by flushing. Remember, fentanyl patches should never be flushed if utilizing a septic system. If using a septic system, used fentanyl patches should be placed in a sealable bag and brought to your local pharmacy for disposal. The U.S. Food and Drug Administration has a website with tips on disposal. The first thing that the FDA recommends is to read the label and/or consumer information. It will tell you what to do. If in doubt, call a pharmacy. Some drugs can be disposed of in the household trash. Simply mix the medication with something undesirable, such as kitty litter or coffee grounds, and seal in a bag or disposable container. Others should be flushed. Keep in mind that drugs should only be flushed if the label or patient information provided on the container tells you to do so. Others should be returned to a pharmacy or other approved take-back site. We can all do our part to make our homes, families, and communities safer when it comes to prescription opioids. Properly storing if prescription opioids are needed and disposing of unused medications is a key step in preventing accidental exposures and diversion. Here are some links that provide more information on opioids and the proper methods of storage and disposal. Please visit our project website for more information, resources, and materials.